What's up, everybody? Welcome back to the RT Clinic. Today's video I am demoing and showing you how to set up the Astral 150 transport vent. We've got two limbs on this circuit and this thing's pretty sweet. So let's go. So as you see, this is the Astral 150. We can flip it around here, look at the back. On the back, you're gonna see this is the blower. On this side, we have an oxygen import. So this is actually where we're gonna add in the oxygen via liter flow. So we're gonna add a liter flow into this and adjust the FiO2 from that. Also have a couple other connections which we won't use. You have an AC plug here for charging, and then you have the on and off switch right here as a toggle. Let's flip it over. So on this side, you're gonna notice you have inspiratory and expiratory sides, and these can actually be changed out. And let's get to that and I'll show you how that one works. Three, two, one. So obviously you can see on here we have our from patient to patient. This can be a dual limb or a single limb. I'll show you how to take this expiratory side off. Push the button right here. Shouldn't need to do this clinically because once these are set up, and we're going to use these for transport vents, shouldn't need to do that. And then if you see here, you can pull that out, and that piece fits directly into there. So that's your expiratory side. Should never have to mess with this because we're going to run these as a dual limb circuit with the inspiratory and expiratory side. That clicks into place. Pretty easy. To patient, from patient, and both of these will hook up directly to your circuit. So on the front here, of course, you have, this is the only real hard key on it, is your alarm mute reset. And then let's hook up our circuit so we can get this running. Circuits we're using are these super nice Draeger coaxial circuits. Our hospital uses these for open heart patients. They're great for transport also. They are inexpensive, which is good, and dual limb. Use HMEs on these for short-term patients. So if you haven't seen these before, they're pretty sweet how they work. So this is actually the inspiratory side here. Goes down the center, and all comes through one tube, which is really nice, so you're not battling two tubes the whole time. And then expiratory comes on the outside, comes out through here, and this is the expiratory side. So very easy how they hook up to the patient, from the patient. What's also kind of cool about it is you can kind of grab it like right here, and it works really well if you're carrying it or if you have to move it during transport. So, and it's a good way to kind of keep those two things sealed in there. So that works excellent. And then you have your patient Y, which is not much of a Y because it's a coaxial circuit. So anyway, that's how that works. So let's turn this thing on. On-off switch in the back. It's a toggle switch. We have our ResMed coming up. So you can see when it initially comes up, it's going to look a little bit like this. We're using an internal battery right now. You have the reading at the top here that says 95% of your battery is left. And this thing is not charged for a long time. It's been sitting in my office for a while. So it does hold battery really well. It'll also give you a time up here if you're running this on a patient. First things first is you have to unlock this thing because it is set up for home use or whatever you want, but we're going to use this for acute care setting. So if you see the lock right there, I'm going to press that, hold it. It's going to come up now. It's going to say enter clinical mode. What do you want to do? 20 minutes or unlimited? Definitely unlimited. And now, boom, this looks really similar to what we're doing on our mechanical ventilators. So it has a lot of aspects to it. We'll go through a few things here. We have some programs here. I'm not really going to jack with any of this. This is kind of like we just need to set it up and go type of thing. So program, setup assistant, not worried about. The circuit though is kind of nice because you can tell it what circuit we have. We have a dual limb circuit, learn circuit, so you can actually have it learn the circuit. I'll show you how to do that. So turn off oxygen, disconnect circuit from ventilator. It's a real simple test, and you're going to see it run through this test real quick. All right, attach the circuit, humidifier, leave the patient end open. So this end open, continue. Checking circuit resistance, slowly increases the flow. All right, block the end of the circuit. This is a compliance test. Bingo. Now you have resistance compliance. It knows the circuit that you're using. And we should be good to go here in a second. So you're going to know that all the values you're delivering to the patient are going to be accurate when you do these tests. It's going to, especially because not every circuit is built the same. Not everyone is as compliant or resistant as the other. You can see it passed all the tests on here. We're going to hit confirm. So at this point, you have the option for your patient interface. You can change it to invasive, mask, or mouthpiece. We're not doing mouthpiece, definitely. Could do a mask with this, so you could transport a non-invasive patient on one of these. We're going to do invasive. It shows a tracheostomy tube. We could use a ZT tube, obviously. So we'll go back. We're going to leave it on that. Trigger is pressure triggered. We can do pressure or flow, whichever suits you. I'm kind of a fan of the flow trigger, so I'm going to put it on flow. And then next one, we can go to settings. So the cool thing about settings on this is very similar to a lot of other ventilators you're going to see. You have your volume modes on the top, assist control, SIMV. You have some pressure modes here, including CPAP. So, and pressure support, SIMV and AC. So the modes that you need for transport are here to maintain that alveolar recruitment while you're transporting, so you're not using bag valve mask ventilation or using some other more rudimentary type of ventilator. This really can help to maintain your patient during the transport. Let's go with AC. You can go and change your the volume that you'd like, PEEP, obviously, rate. You can do your flow shape. You can do descending square, descending ramp, square, whatever you want. So like I said, this gets kind of technical. Let's do a descending ramp on the flow. Flow trigger, I'm usually a fan of the 2 liters per minute. And TI, so your inspiratory time, you can set that. When you change inspiratory time, obviously it's also going to change your ID ratio. We know that. And when you change up TI, changes your flow rate. So if you like flow better than TI, you can use that for your flow. So there we go, ready to rock. We can go to the next one. USB, we're not going to, let's apply these settings first. USB, we're not going to worry about this patient data, and then data config, we're not going to worry about that either. So let's get it started and start vent and possibly think about attaching a patient. Now we have the information in here. We're going to hit start vent. I'll attach my test patient first. There we go for my test lung. Start vent. And you can see it start ventilating. So ventilating, see some pressures over here. This is kind of the cool part that I really like about this, is when you get into the monitoring screen. So you have scalar pressure and flow graphics on here. You can go into more monitoring, and you got a bunch of information if you want it. Your inspiratory pressure, your current pressure, your PEEP, all those pressures are in there. You can even look at trends if you want to. Not that you would do that in transport, but it works really well for that, for setting that up. Also, this is back to your setup. This is where you can change your mode if you'd like to, and your alarms. It has a lot of alarms on it. Alarms are nice in this case. We have inspiratory tidal volume, expiratory tidal volume. Which one's more important? Oh, the expiratory all day long, because that's how you ventilate. Inspiratory and expiratory minute ventilation, and your high and low pressure. So those are all easy, touch, adjust, confirm with apply, and then you're ready to roll. So you have other alarms that you can set. Apnea response, so you can see apnea response, in this case alarms only, or you can do apneas that change. If your apnea response, you want it to change to an AC mode. Obviously we're in AC mode, so it's not going to have that, but you can change those apnea response. So, and then your disconnect alarm, you can change that on here too. Let's apply that. Disconnect alarm, what the tolerance is for that. And then you can change your volume, so to make it super high or super low. We can unlock that as we hold. Let's see if how loud it gets. It's pretty loud. There we go. So it defaults at 3. We'll go back to 3. So you can always test the alarm too. So back to monitoring, we can look at our waveforms here, and you can look at this for your settings, for your patient values. Pretty easy how that works. One real key is you see up here in the top, you have your hours it's going to be running. And now let's say your patient's on oxygen, because most of our vent patients are. FiO2, you see it right here. FiO2 is 21 right now. So what you're going to do is we're going to add in some extra flow. So let's do that. So these are standard settings. I mean, let's go in and tie in an oxygen tank to this. Now you will notice this does have a little piece. This does have a little piece on the back that this oxygen tubing connects to. Don't break that off. We'd have to get a new nipple on that if you do. So please don't break that off. So we're looking at our FiO2 right here. We see it at 21%. I'm going to turn up my flow. Let's turn it up to 8. And so this method has an internal analyzer. So what you're going to notice is your FiO2 is going to go up. And so you're going to get your settings going, and then you're going to adjust your liter flow to get the FiO2 that you would like. You can see with these settings, at 8 liters per minute, we're going to be running, looks like possibly about 70% of FiO2. So that's going to be really good. So we have that, which is really nice. Let's go back. Which is really nice, 67% right now. You have your time that you can run without being plugged into a battery. And then you have your IntelliOx tank that's going to tell you how long your tank will last. So great for transport, because you'll be able to see all of the values on these, know that you're good to go and how much time you have left. So let's see, we'll try 15. And I believe with 15 liters, we probably can get pretty close to 100%. Obviously, this is going to make us recalculate our IntelliOx tank and make it run much faster. So 50 minutes. We're at 83% right now, which is really good. So there's one kind of funky thing that comes when you do shut this thing off. You have to go to stop vent. Also, you have a alarm silence right here. That's your hard key for alarm silence. That's the button you always hit. The alarm silence, and then figure out what the problem is, or figure out what the problem with your patient is. So let me turn the flow down a little bit in this case. Let's say we're going to go to stop vent. So we're going to take them off the vent. Hit this button right here, and you see I hit it and it won't stay. It wants you to hold for 3 seconds to stop. So I hold it for 3 seconds, release key, turn off oxygen, stop ventilating. So turn off the oxygen. Now I'll do this again. Confirm. Bingo. Shuts it down. Shows all your battery information. It saves your settings in there. You should need to do this, but you could lock it again if you wanted to. In exit clinical mode, you could confirm. In this case, we'll leave it out. It will not default to come out of clinical mode, so you have to, every time you turn it on, you have to go up here and unlock it. Run the circuit test, put some settings in. Other than that, it should be extremely easy to run this. This is the Astral 150. 2 of these at the main hospital and 2 of them at the critical access hospital. It is a nice option for transport, and also it'd be a great ER vent if you're having somebody on for a temporary amount of time. We're using this with dual limb. It also can be used single limb. You could do dual limb for non-invasive if you want to also. You just have to make sure you do not have any kind of expiratory ports on the mask. You have to have a sealed mask because you're going to exhale back through your expiratory side. So, hope you like it, and let me know if you have any questions later.